all about traumatic brain injury, ways of healing, methods of healing, traumatic brain injury, what you must know. A traumatic brain injury is a serious medical condition that can extremely affect the life of a human being. It is also known as a TBI, closed head injury, or just head injury. It can be a confusing injury, since it often produces a variety of symptoms that can vary greatly from person to person. Symptoms can also vary in adults and children. The best way to learn about this injury is to look at the different symptoms for each type of traumatic brain injury. Causes of traumatic brain injury. An injury to the brain can be caused by any type of blow to the head. In many cases, it is obvious when a brain injury has occurred. A car accident, for example, may cause a traumatic brain injury that is very apparent. However, some injuries are not as apparent. Someone who falls and then gets right back up may not have realized what they have just done to their brain. It is not until later, when symptoms present themselves, the person notices something is wrong. When someone suffers a traumatic brain injury, there might be visible swelling or bruising. In some cases, this swelling and bruising may only be inside the skull. When the brain starts to swell, it presses against the skull and causes serious effects, even possibly death. Types of traumatic brain injuries and symptoms. A mild traumatic brain injury is one type of brain injury. The symptoms of this type of injury include unconsciousness, amnesia, where the person forgets the events that lead up to the injury, and those following the injury, headache, confusion, dizziness, blurred vision, and mood changes. Moderate to severe traumatic brain injuries can produce persistent headaches, vomiting, seizures, and problems waking up from sleep, dilated pupils, and problems with speech, weakness in the body, and problems with coordination, confusion, and changes in temperament. Mild, moderate, and severe traumatic brain injuries to the head are the type of brain injuries specific to adults. These injuries in children are much different. Children may not be able to tell you how they feel, and they may not have the skills developed yet to recognize that something is indeed wrong. Symptoms of an injury to the head in children include problems eating, cranky moods, problems sleeping, problems in school, and loss of interest in favorite activities. Seeking temperament. After an injury to the head or the surrounding area, or other traumatic injury, or fall, a person should be checked by medical personnel. Any situation where the body bumped roughly or otherwise injured could lead to a brain injury. The brain can easily bump against the skull and swelling can begin. It is better to be safe with any type of head injury and seek immediate medical treatment as soon as possible. In most cases, the doctor will simply observe the patient for a short period of time to see if symptoms of an injury to the head are present. An injury to the head should always be taken seriously. The brain is a complex organ that can be easily injured. It is important to always seek medical care if a traumatic brain injury is suspected, so that treatment can take place and further problems can be avoided.